The convergence of AI and vision is more than a technological advancement. It represents a profound shift in how we understand both machines and ourselves. For decades, artificial intelligence has been about logic, numbers, and language. But now AI is learning to see, and that changes everything. The human eye is a marvel of evolution, capable of capturing light, depth, and motion in ways that even the most advanced cameras struggle to replicate. Yet, for all its brilliance, it is still limited. We rely on doctors to interpret what our eyes reveal, from the obvious signs of vision problems to the subtle indicators of disease. Artificial intelligence, however, is not bound by those limits. With its ability to process millions of images, detect invisible patterns, and learn from vast datasets, AI has begun to replicate and in some cases surpass the diagnostic power of human sight. Imagine an algorithm that can analyze a single retinal scan and within seconds identify the early onset of glaucoma long before any symptoms are felt. Think about a system that can spot microvascular changes in the eye that hint at diabetes or hypertension. These are not distant hypotheticals, they are realities being tested in hospitals and clinics around the world today. The power of AI lies in its ability to transform the eye into more than a sensory organ. It becomes a gateway to the body's entire health ecosystem. By teaching machines to see, we are essentially extending the boundaries of human vision into dimensions previously invisible. But the convergence of AI and vision is not just about medicine. It's about how we navigate the world itself. When machines can see as we do, and sometimes better than we do, the relationship between humans and technology becomes collaborative. Think of a driver assisted not only by cameras, but by AI-powered systems that anticipate dangers on the road before they appear in human sight. Consider classrooms where AI-enhanced glasses can recognize when a child is struggling to read text and adjust accordingly. The implications go far beyond healthcare. They redefine how we interact with reality. There is also an emotional dimension to this convergence. Human sight is deeply tied to trust, empathy, and memory. When we look into someone's eyes, we connect. Now imagine AI that can interpret eye movements, pupil dilation, subtle changes in gaze to understand mood, stress, or even cognitive load. It is not about replacing human intuition, but augmenting it. In workplaces, this could mean systems that detect fatigue in workers before accidents happen. In mental health, it could mean new tools to identify early warning signs of depression or anxiety. This is where the future of vision diverges from the past. The eye is no longer just a biological organ. It becomes a data-rich interface between humans and intelligent machines. The convergence of AI and vision is the foundation of a world where seeing is no longer just believing. It is predicting, preventing, perceiving more than ever before. Smart glasses are not merely a futuristic gadget. They are the next great interface that will transform how we experience information, healthcare, and even human connection. For centuries, eyewear has served one fundamental purpose: to correct vision. The invention of spectacles in the 13th century was revolutionary because it allowed people to extend their working lives and improve their quality of sight. But what is coming next is not just correction, it is augmentation. Smart glasses represent a turning point where the act of seeing will merge seamlessly with the act of knowing. When we think about the history of computing, each era has been defined by its interface. The typewriter led to the personal computer. The mouse and graphical interface unlocked the web. Touchscreens gave rise to smartphones. Each shift did not just change the device in our hands, it rewired how we interacted with the world itself. Smart glasses are the next step in that evolution. By placing information directly in front of our eyes, they collapse the barrier between the digital and the physical. No longer will we glance down at screens for updates or search for information in a device tucked away in our pockets. The world itself becomes the screen. In the field of eye care, this has extraordinary implications. Imagine a pair of smart glasses that can monitor your vision in real time, tracking changes in focus, eye strain, even subtle shifts in color perception. Instead of annual checkups, your glasses become a living diagnostic device, constantly learning about the state of your eyes. If something begins to shift, a sign of early macular degeneration, for example, Your glasses can flag it instantly and send the data to a healthcare provider. Eye care moves from reactive to proactive, from occasional visits to continuous care. But the role of smart glasses goes beyond diagnostics. They can also become platforms for assistance. For the visually impaired, real-time image recognition can help identify objects, read text aloud, or navigate unfamiliar environments. For children struggling with vision development, glasses could gamify eye exercises while ensuring proper correction throughout the day. Even in everyday life, adaptive lenses could adjust not just for brightness, but for the cognitive load of the wearer, sharpening focus when concentration is required or reducing visual noise in moments of fatigue. There is also a profound social and cultural impact to consider. Just as the smartphone changed communication and commerce, smart glasses will redefine presence. Augmented reality overlays will allow us to see directions on the street without maps, translate languages instantly in conversation, or access medical data while examining a patient. In eye care clinics, practitioners could use them to visualize conditions in 3D or guide patients through treatment options more clearly. Of course, this future raises challenges. The constant presence of cameras and sensors in smart glasses sparks debates about privacy, surveillance, and ethical use. Yet, the momentum is undeniable. Smart glasses are more than a device. They are a platform for a new relationship between our eyes, our health, and the digital world. They promise not just sharper sight, but deeper insight. The future of eye care will no longer be confined to diagnosing problems after they appear. It will be about predicting and preventing them before they have a chance to disrupt lives. Traditionally, patients visit an optometrist or ophthalmologist when symptoms become noticeable: blurred vision, discomfort, or headaches. By the time these issues are detected, the condition is often already progressing. This reactive model has defined eye care for centuries. But with the rise of artificial intelligence and continuous monitoring through wearable technology, that model is about to be overturned. AI has the capacity to analyze enormous data sets in ways that reveal trends invisible to the human eye. A single retinal scan can contain information about vascular health, metabolic changes, and even neurological patterns. By studying millions of such images, AI can learn to detect tiny variations that may signal the earliest stages of disease. Instead of waiting for vision loss to become evident, a predictive system could alert patients to the risk of glaucoma, macular degeneration, or diabetic retinopathy years before traditional methods would have caught it. Prevention then becomes a natural extension of diagnosis, offering people a chance to change their lifestyles, adjust treatments, or take protective measures long before damage is done. Consider the implications for children. Myopia, nearsightedness, is increasing worldwide, particularly in regions where children spend significant time indoors on digital devices. By the time many children are diagnosed, their vision has already deteriorated. With predictive eye care powered by AI, smart glasses could track eye growth and strain patterns in real time. Subtle changes in behavior, such as prolonged near focus or reduced blinking, could be detected and corrected early, possibly slowing or even preventing progression. Parents would no longer rely solely on annual eye exams. They would have continuous insights into their child's visual development. The same approach applies to adults at risk of systemic diseases. The eye is one of the few places where doctors can directly observe blood vessels without invasive procedures. This makes it a rich source of data for predicting broader health conditions like diabetes, hypertension, and even cognitive decline. With AI-driven predictive tools, eye care may evolve into general health care. An individual's eyewear or routine eye scan could flag risks far beyond vision, prompting early intervention across multiple medical domains. Predictive eye care also carries profound social benefits. Rural or underserved areas where access to specialists is limited, AI can bridge the gap. Simple smartphone-based retinal camera connected to an AI model could provide instant analysis and risk assessments, allowing people to take action without waiting months for an appointment. This democratizes care, making prevention accessible to populations that have historically been left behind. What makes prediction so powerful is that it transforms healthcare from an emergency response into a continuous, invisible support system. Rather than patients reacting to problems, they live with the assurance that their vision is being safeguarded in the background. In this future, blindness from preventable causes could become far less common. The eye care of tomorrow will not just restore sight, it will protect it before it is ever at risk. Personalized vision enhancement represents a radical reimagining of what it means to see clearly. For most of human history, vision correction has been standardized. A pair of glasses or contact lenses are prescribed based on a snapshot of your eyesight at one moment in time. Once created, they remain static, offering the same level of correction whether you are reading at night, driving through fog, or staring at a computer screen for hours. But the future will not be static. With advances in AI, adaptive optics, and wearable technology, lenses will become dynamic, tailoring vision to the unique needs of each individual in real time. Imagine glasses that automatically adjust their focus depending on what you are looking at. If you glance at your phone, the lenses sharpen near vision. If you look up at a distant road sign, they instantly recalibrate for long-range clarity. No need for bifocals or progressive lenses. Your eyewear becomes an intelligent system that understands your visual intent. This alone would revolutionize comfort and usability, but it is only the beginning. AI-driven personalization will go further by integrating environmental and biological data. Consider how lighting conditions affect vision. In bright daylight, your lenses might reduce glare and optimize contrast, while in dim evening light, they could enhance sharpness and reduce halos. For digital work, they might filter harmful blue light dynamically, not with a static coating, but in response to the actual strain your eyes are experiencing. The glasses would not only correct vision, but actively manage it, minimizing fatigue and maximizing performance throughout the day. Beyond environmental adaptation, personalization will also extend to cognitive and emotional states. Our eyes are deeply connected to our brain, and vision is as much a neurological process as it is optical. Smart glasses of the future may detect signs of mental fatigue through subtle changes in eye movement and then adjust vision to ease the load. For someone under stress, the lenses might soften visual noise and increase clarity of key details, providing a calmer, more focused experience. For drivers on long journeys, they could enhance contrast sensitivity to keep attention sharp. Vision becomes more than correction. It becomes optimization. The implications for education and work are enormous. Students who struggle with reading disorders could benefit from glasses that highlight text in ways tailored to their cognitive processing. Designers, surgeons, or pilots might use vision enhancement tuned to the precision demands of their tasks. Personalized vision will not be a luxury. It will be a tool for performance. Much like personalized training programs in athletics, there is also a profound opportunity for inclusivity. People with partial vision or unique visual impairments could finally experience correction designed around their specific needs rather than generalized prescriptions. Every pair of lenses could be as unique as a fingerprint, learning from the wearer's habits and continuously refining over time. This shift transforms eyewear from a corrective device into a personal assistant for sight. Vision will no longer be a fixed prescription written on paper. It will be a living, evolving relationship between your eyes, your environment, and intelligent technology. Personalized vision enhancement is not just about sharper sight, it is about unlocking human potential by tailoring the very way we experience the world. The saying that the eyes are the window to the soul has always carried a poetic truth. The future, they will also become a window into the entire human body. What we often forget is that the eye is the only place in the body where blood vessels and neural tissue can be directly observed without invasive procedures. For doctors, this makes it an extraordinary diagnostic portal. For artificial intelligence, it opens up possibilities that extend far beyond vision care. With powerful algorithms analyzing retinal images and eye activity, the eye could become a frontline tool for detecting systemic diseases, often before any symptoms emerge elsewhere in the body. Take cardiovascular health as an example. Subtle changes in the tiny blood vessels of the retina can signal hypertension or elevated cholesterol levels. Traditionally, such conditions might remain undetected, until they cause significant harm, but AI can learn to recognize these microscopic clues long before they reach a critical point. Routine eye scan could reveal risks of heart disease without requiring blood tests or complex imaging. In the same way, early signs of diabetes can be spotted in the retina years before patients experience symptoms, allowing interventions to begin sooner and outcomes to improve dramatically. The eye also provides insight into neurological conditions. Disorders like Alzheimer's, Parkinson's, multiple sclerosis leave faint but detectable traces in the retina and optic nerve. AI has already begun to identify patterns of change that correlate with these diseases. In the near future, a standard eye exam may serve as an early warning system for cognitive decline. Instead of waiting for memory loss or motor symptoms to appear, interventions could start while the disease is still in its earliest and most treatable stage. This diagnostic potential does not stop at chronic disease. Stress, fatigue, and even mental health conditions leave subtle signatures in eye movements and pupil responses. AI-powered systems could track these markers continuously, offering real-time feedback not only for doctors but also for individuals themselves. A pair of smart glasses might notice elevated stress levels and prompt the wearer to take a break, or it might detect abnormal eye behavior that warrants further medical evaluation. What was once a simple tool for vision correction could become a constant guardian of holistic health. The impact of this shift is profound. Healthcare will move from being episodic, centered around doctor visits and tests, to continuous, with the eye acting as a permanent health sensor. This democratizes access as well. In underserved communities where advanced diagnostic equipment is scarce, portable eye scanner or AI-equipped glasses could serve as a gateway to broader medical insights. The eye could be the bridge that connects millions of people to preventative care they otherwise would not receive. Ultimately, the eye will no longer be treated as an isolated organ. It will be recognized as an integrated part of the body's diagnostic network, a biological interface that reflects everything from vascular health to neurological resilience. By unlocking the secrets hidden in the retina, we are not just safeguarding vision. We are transforming eye care into a comprehensive model of healthcare itself. The promise of augmented vision carries with it extraordinary potential, but it also forces us to confront some of the most complex ethical challenges of our time. When technology moves from simply correcting human limitations to enhancing and augmenting them, the very definition of fairness, privacy, even humanity comes into question. Smart glasses and AI-driven eye care are not just tools for better health, they are gateways into a future where seeing is no longer equal for everyone. And that raises profound dilemmas. One of the first ethical concerns is data. Smart glasses that monitor your vision, track your eye movements, and analyze your health are not just helping you see, they are constantly collecting information. This data includes not only medical indicators, but also behavioral insights. What you look at, how long you focus, what captures your attention, and even your emotional state. In the wrong hands, such information could be misused for surveillance, targeted advertising, or manipulation. The question becomes, who owns the data generated by your eyes? Is it you, the patient? Is it the company that built the device? Or is it shared with third parties? Without strong safeguards, the most intimate window into your mind and body could become a commodity. Another concern lies in inequality. Vision augmentation will not arrive equally to all people at the same time. Advanced smart glasses capable of enhancing clarity, boosting focus, or even overlaying augmented reality will likely be expensive in their early stages. This risks creating a society where those who can afford enhancement will not only have better health outcomes, but also competitive advantages in education, work, daily life. Imagine a classroom where some students see information overlaid in real time, while others must struggle with traditional tools. Or workplaces where enhanced employees can process information faster and more accurately than their peers. The risk of a new kind of visual divide is real, one that extends beyond healthcare into economics and opportunity. There is also the philosophical question of human authenticity. If our glasses can filter the world, highlight what is important, or even soften unpleasant realities, Do we risk creating curated versions of reality rather than facing the world as it truly is? For some, this could enhance focus and reduce anxiety. For others, it could create a dangerous detachment from unfiltered human experience. Augmented vision blurs the line between assistance and dependency, between enhancement and distortion. Finally, the issue of consent must be addressed. Children may grow up wearing smart glasses that track their development and health, but are they able to consent to that level of monitoring? Workers may be encouraged to use augmented eyewear in the name of productivity, but what happens to their right to privacy? These are not theoretical questions. They will define the social contract of the future. The ethics of augmented vision cannot be an afterthought. As powerful as the technology will become, it is only valuable if it serves humanity rather than divides it. The choices we make today about ownership, access, and boundaries will determine whether augmented vision becomes a tool of empowerment or a source of inequality and exploitation. In shaping this future, must ensure that what we choose to see is not only sharper and clearer, but also more just and humane.